Methodist Family Health has a long history of caring for children and families. Starting in 1899 as an orphanage and later expanding to a handful of group homes for children, today's Methodist Family Health has evolved into a multifaceted network of behavioral and mental health programs and services for children and families in Arkansas. From outpatient counseling to residential treatment, Methodist Family Health provides a circle of compassion, a continuum of care designed to treat the whole person, behaviorally, emotionally, and spiritually.
Methodist Children's Home has 3 residential programs. The group home program, which has been in existence the longest, provides a family-style environment in a community home for children who need placement outside their home for long periods of time. The residential treatment centers provide care for children normally ages 6 to 18 in a safe clinical environment, and these are children who have significant problems in several areas of their life. The therapeutic foster program takes children who have problems and need placement outside their home for a period of time to receive treatment and then hopefully move back home and reunite with their family. We also have an emergency shelter program. The children in our emergency shelter program are only here a very short time, be that a few days or a maximum of a few weeks. They come in with no notice, have usually very few or no resources, and need an immediate placement. Our day treatment educational programs serve children who cannot attend public school for various reasons. Our Arkansas Cares program serves women who are trying to beat addiction problems, and it does so in a way that's unique compared to many other treatment settings. We allow and in fact insist that the mothers bring their children with them to help them try to rebuild their family during their treatment.
Services provided through Children's Home touch many Arkansas children and families. Methodist Behavioral Hospital provides the most intensive level of behavioral health care and is a critical part of Methodist Family Health's continuum of care.
Here at Methodist, we provide acute and residential services for children and adolescents 3 to 17 years old. Once a child arrives at Methodist Behavioral Hospital, a comprehensive assessment is completed by a professional. We look at data that would put the child at risk or others at risk for injury or harm. That then is looked over by a board-certified child and adolescent psychiatrist, and it would be determined whether the child would be admitted. If the child's admitted, I've got 2 different teams that work with this child. One working with the treatment, one setting goals and accomplishing goals with a therapist, and then I have a team that's already preparing for discharge. Ultimately, our goal for all of our children is to provide a safe environment, stabilize their needs where they can be productive citizens.
Outpatient services are another aspect of that continuum of care.
Outpatient services with Methodist Family Health is the least restrictive department in our continuum, and what that means is we provide services in the community. The goal of services in the outpatient department is to really help clients to address their symptoms and help the family be able to help their child develop some coping skills that will help them in their everyday life. And having the families be a part of that helps the client be more successful. That is what's important to us in outpatient, is to treat not just the individual but the family and the whole person.
Clients may enter the continuum of care at any point and then move within that continuum as their care dictates. Andy Altum, CEO of Methodist Family Health, oversees the entire organization.
The mission of Methodist Family Health is to provide the best care possible for the children and families that may need our services. We currently serve daily 1,400 children and their families here in the state of Arkansas. In all of our continuum, we use the same model of care as far as how our staff interact with the kids, and that's using the teaching family model. When we take a child in, they're going to get help regardless of the different levels of care they need.
Methodist Family Health is a critical ministry and vital mission for all of Arkansas. With deep Methodist roots and over a century of history and experience, Methodist Family Health continues a tradition of help and concern for children and families. Methodist Family Health, your continuum of care.